Hi guys, Dr. Kendra Pope here. Welcome back to my channel. Today I want to talk with you a little bit more about what is an integrative veterinary oncologist and how is that different from another oncologist. So what that means is that after I went to veterinary school, I went on to do a residency in oncology. So basically after medical school, I went on and did 4 more years of training just treating animals with cancer. But after that, I spent another 15 years dedicating learning and continuing education to natural modalities and integrative and natural therapies. And what that has really done is that's really informed my approach and my philosophy in how to treat a cancer patient, and I want to share that with you today. So when we think about a veterinary oncologist and all the amazing things that they do to help our pets with cancer, usually when we are putting together a treatment plan for a patient, it's based on a diagnosis. It's based on a disease. Usually a specific type of cancer that your pet would have. So this would be something like lymphoma or osteosarcoma or hemangio. Those types of cancers, those disease diagnoses, are how we decide how to treat a patient. And based on that diagnosis, lots of clinical studies have been done to inform our decision on what type of therapy is available, what type of chemo or radiation or surgery, what type of outcomes we can expect with them, what type of survival times. And that's the kind of information and data and treatment plans that you'll get when you take your pet to see an oncologist after a cancer diagnosis. They're really the cancer specialists to help give you all that information to help to make an informed decision about the conventional treatment options you have. The difference between that type of approach and the approach of an integrative oncologist is kind of shifting the focus away from the weed, the cancer, to the garden and the soil. What I always tell my clients and my colleagues is that I consider myself the gardener. We play in the soil around the weed. Because what we're doing is we're trying to change the environment and make it as inhospitable for the cancer as possible, while also strengthening the rest of the garden. So it's the shift from the disease focus or the tumor focus to the patient focus. Now, this doesn't mean that one is better than the other or one can be used without the other. They actually are very complementary and can work very well together. But sometimes the decision to pursue conventional treatment like surgery or chemo or radiation is not the right one for the pet parent, and they elect not to do that. So in those instances, then those natural therapies, those integrative therapies can really take over. So let me give you another example on a typical patient that we might see and how this might vary and be different. So we could have 2 patients come in for a consultation. Both of them may have osteosarcoma, one of the most common bone cancers in dogs. And if they came to me as a conventional oncologist, because their diagnosis was the same, most of the time their treatment plan would be pretty similar. Now there's nuances to that and maybe some exceptions, but most of the time the treatment plan would be the same. If those same 2 patients come to an integrative oncologist, their integrative treatment plans absolutely 100% of the time will be completely different. And that's because cancer cannot grow in healthy soil. And the soil and the changes to those soils are going to affect those patients' specific cancers. Now, what does that mean? Well, cancer cells are derived from our own cells. They're not outside invaders. They don't come from outside like a virus or bacteria. They're our own cells that have changed and have grown out of control, and because of the mechanisms out of balance, are able to grow continuously. Those specific characteristics of those cancers are going to be specific to that patient. Different genetic mutations, different factors driving them, different inflammation status, gut health, toxin burdens. And all of those different factors contribute and play into the specific cancer that that patient has. So there's no way that their integrative treatment plans would be the same because each cancer is individual to that patient. So what that might look like is that both of them may be on a diet plan that changes, or an herb or supplement plan that changes, or maybe some other types of more direct natural anti-cancer therapy, like using things like mistletoe or vitamin C. But the exact herbs or dose or schedule or protocol used for those patients is going to be tailored and individualized for them because their cancer is specific to them. Now, if we think about this, this is actually the way that human oncology treatment is going also. Although chemotherapy is still the standard of care for many of our cancers, chemotherapy on the human side is actually changing to be much more targeted and individualized. And what that might look like is if you've had a loved one who've gone through cancer treatment, you'll know that they have lots of special genetic testing done that basically identifies the exact specific nature of their cancer. And those results help to guide the type of chemotherapy or immunotherapy that that patient is receiving. We know from studying these patients and from cancer research over time that the more individualized we can get and the more specific and tailored we can get to treating a patient's cancer, the higher success and better outcomes that we're going to have. So when a patient visits the practice, the approach that we take is I always tell my clients, my patients are like little stinky onions. We have to peel back the layers one at a time, getting as close as we can to that core, which is health. So whether this is a cancer diagnosis or chronic disease or immune or allergies or any other problem, we're always going to peel back those layers one at a time, addressing that soil that is unhealthy that's causing the problem at the core. So stay tuned as I talk more about what tools are in my toolbox and what can we use to address and to start getting deeper as we pull back those layers. We'll see you guys next time.